Hi, I'm Mark Crowther, and I'm at the 2016 American Society of Hematology meeting in San Diego, California. And at this meeting, I'm presenting the results of our Phase 2 study looking at the reversal of betrixaban-induced anticoagulation by andexanet alpha. And I'm presenting on behalf of my co-authors from Portola Pharmaceuticals and McMaster University. In listening to this presentation, you should understand that I have disclosures to make, the most importantly of which I am a consultant to Portola Pharmaceuticals, the company that both makes andexanet alpha and also sponsored the research that I will be presenting. And andexanet alpha is not approved in any jurisdictions at this point in time, and as a result, all of the discussion I have today will be off-label. Andexanet is a chemically manufactured recombinant factor 10A decoy molecule that has had two chemical changes made. The first is the GLA domain has been removed, which prevents the agent from interfering with coagulation, and the second is that the active site has been modified so that it can still bind 10A inhibitors, but it is unable to participate in coagulation. As a result, it works as a true decoy, binding to and inactivating 10A inhibitors without interfering with coagulation. The study that we talked about at the ASH meeting takes two groups of patients who are dosed to steady state with betrixaban at 80 milligrams once daily, which is administered for 7 days, at which points they're randomized. The first group is randomized to receive an andexanet bolus alone or placebo, and the second group is randomized to receive andexanet as a bolus followed by an infusion or matching placebo. In both cases, the bolus is 800 milligrams and the infusion is 960 milligrams or 8 milligrams per minute for a total of 2 hours. The results are presented in the same fashion as our previous studies looking at andexanet. On the y-axis, we have the anti-factor 10A level, the measurement of the degree of inhibition of coagulation provided by the agent, and on the x-axis we have time. The first break is up to 0.6 of an hour and then in hourly increments afterwards. The gray circles in this slide indicate the effect of a placebo infusion on the 10A activity of betrixaban. As you can see, and as we would expect, there is no influence. Administering placebo did not affect the pharmacokinetics of betrixaban. However, if we administer a bolus or a bolus followed by an infusion, we see an immediate and near normalization of the betrixaban anticoagulant effect, followed by prolonged suppression if we use an infusion, or followed by a return back to the expected level with a bolus. These results are very similar to that we've seen in our previous work with rivaroxaban and apixaban. At 2 hours, the betrixaban levels have returned to close those we would expect from the natural decay of the product, and the levels then tail off at the expected rate. Remember, betrixaban has a longer terminal half-life than rivaroxaban or apixaban, so the rate of decline in the levels is lower. This looks at thrombin generation. The x-axis is again hours as previously. The y-axis is a little different here in that the first value is actually in the healthy volunteers before they receive betrixaban to establish a reference interval. As you can see, when anticoagulated, the thrombin generation falls to a level well below that of the pre-specified mean and its standard deviation. And then almost immediately with the administration of andexanet, but with not following the administration of placebo, we see a correction of the levels into the expected reference interval, which is sustained throughout the duration of follow-up. We conclude from this that andexanet rapidly and nearly completely reverses the anticoagulant effect of betrixaban as measured by thrombin generation. In summary, betrixaban-induced anticoagulation is effectively reversed by andexanet alpha in this experimental model, looking at anti-factor 10A levels as the primary outcome. Thank you for your attention.